Hi, my name is Chris Hammer, and this is my presentation on the cardiovascular system. The cardiovascular system consists of the heart and the circulatory system. Now, the heart is essentially the pump, which pumps the blood, and the circulatory system does exactly what you think it does. It circulates the blood throughout the body. It does this using hemoglobin, which will transport the oxygen to the necessary tissues and cells. Along with providing oxygen, the blood removes waste products like carbon dioxide and other waste products, and transports that back to the heart through the veins. Now, it's important to remember that veins always travel towards the heart, generally carrying deoxygenated blood, except for one exception, which I will get into a little later. As I stated earlier, the heart is the body's pump, and it's separated into 4 quadrants. Now, the quadrants are the right atrium, the right ventricle, the left atrium, and the left ventricle. Now, the veins empty into the inferior vena cava and the superior vena cava, depending on if they are from the lower part of the body or the upper part of the body. Now, the vena cavas empty into the right atrium. Now, this deoxygenated blood will fill the right atrium. That is done by the tricuspid valve being closed, allowing the right atrium to fill with deoxygenated blood. Now, when the tricuspid valve opens after the right atrium is full, the right ventricle is allowed to fill with blood. Now, when the right ventricle is full, it will contract, and this contraction will allow the blood to go into the pulmonary artery here. Now, the pulmonary artery is blocked by the pulmonary semilunar valve. Now, the pulmonary semilunar valve will open, allowing this deoxygenated blood to go from the right ventricle into the pulmonary artery. Now, the pulmonary artery, it's important to note, that is the only artery that I'm aware of that allows deoxygenated blood to travel through it. But it is still an artery because it's going away from the heart. Arteries always go away from the heart. Veins go towards the heart. Now, the deoxygenated blood is going away from the heart to the lungs, where it comes in contact with the alveoli, which will actually give the deoxygenated blood oxygen through breathing and take away the carbon dioxide and other wastes and allow them to be exhaled into the air. Now, after the blood is oxygenated, it is transported into the pulmonary veins. Now, the veins here are transporting oxygenated blood, but they are still veins because they're going back towards the heart. Now, the veins fill the left atrium. The left atrium is allowed to fill because of the mitral valve being shut. Now, the mitral valve separates the left atrium from the left ventricle. Once the left atrium is filled with oxygenated blood, the mitral, or sometimes called bicuspid valve, will open, allowing the oxygenated blood into the left ventricle. When the left ventricle is full, it will actually shut, allowing the oxygenated blood to stay in the left ventricle and not backflow into the left atrium. Now, it's also important to note that the left ventricle is separated from the right ventricle by the interatrial septum, and the left atrium is separated from the right atrium by the interatrial septum. This is the interventricular septum, because these are ventricles. This is the interatrial septum, because these are atria. Now, this valve is called the aortic semilunar valve. The left ventricle, the heart will actually contract. The oxygenated blood will go through the aortic semilunar valve into the aorta and around the aortic arch. This valve will shut so as not to allow backflow. And this oxygenated blood will actually go out for disbursement into the body through the aorta, around the aortic arch, and into a system of smaller arteries throughout the body. The aorta, it's important to note, is the largest artery in the body, and it's very important. Now, here's a poster just demonstrating some of the circulation. As you can see, these are the vena cavas that will go to the right atrium and through the right ventricle and through the heart, as we've noted. They'll go around to the lungs, where the deoxygenated blood will be oxygenated back to the heart and around. The actual exchange in the body takes place when the blood reaches the capillaries. Blood from the capillaries has now, given up the oxygen it was carrying, and it will become deoxygenated and is carrying the carbon dioxide and waste that travels up from the capillaries into the venules, which will go into the veins, come to the superior and inferior vena cava, and go back to the heart to start the process all over again. The normal heart beats 60 to 100 times a minute. The heart rate is controlled by the autonomic nervous system, which has three parts: the sympathetic nervous system, the parasympathetic nervous system, and the enteric system. Now, the sympathetic system will actually speed up the heart rate. It's done by sending impulses from the medulla oblongata to the heart. It's sometimes called the flight or fight nervous system because of this stimulation. The parasympathetic nervous system actually slows down the heart by sending nerve impulses from the brain to the heart. It is sometimes called the rest and digest nervous system. Now, the enteric nervous system will control the heart rate by use of hormones. Now, the electrical function of the heart. The heart actually has an electrical function, which in turn causes the mechanical function. During a normal heartbeat, the electrical impulses in the heart actually start in the sinoatrial node, sometimes, most of the time, called the SA node. Now that electrical impulse will make its way to the atrioventricular node, down the right and left bundle branches, and into the Purkinje fibers. Now, the electrical impulse when they get into the Purkinje fibers will actually cause the heart to contract, forcing the blood from a downwards to an upward motion, which allows the ventricles to disperse the blood. That is my presentation on the cardiovascular system. Hope you enjoyed it. Thanks.